A conservative estimate would be that 5% of school-age children have ADD, and yet it remains poorly understood by the general public, often going unrecognized or misdiagnosed. The hallmark symptoms of ADD, distractibility, impulsivity, and high activity, are so commonly associated with children in general that the diagnosis is often not considered. A child with undiagnosed ADD is thought to be just being a child, only more so. It wouldn't occur to anyone that the more so was a tip-off to a medical diagnosis unless they knew something about that diagnosis in advance. Where does the more so leave off and the neurological syndrome of ADD begin? How can we tell a spoiled child from an ADD child? How can we tell a child with emotional problems from a child with ADD? The diagnosis rests primarily upon the child's individual history. There is no clear line of demarcation between ADD and normal behavior. Rather, one must make a judgment based on a comparison of the individual child to his or her peer group. If he or she stands out as markedly more distractible, impulsive, and restless, and if there is no other apparent cause for this behavior, such as a disruption of the family, or substance abuse, or depression, or other medical condition, then the diagnosis of ADD can be entertained. However, only a professional who has experience in working with ADD should make the diagnosis. The two most common errors in the diagnostic process are missing the diagnosis or making the diagnosis too often. Even professionals who know about ADD can miss the diagnosis if they rely too heavily on psychological testing. While psychological testing can be very helpful, it is not definitive. Children who have ADD can appear not to have it when psychologically tested. This is because the structure, novelty, and motivation associated with the testing procedure can effectively, for the moment, treat the child's ADD. The child may be focused by the one-on-one structure of the testing, focused by the novelty of the situation, and be so motivated to do well that the motivation overrides the ADD. The second most common error in the diagnostic process is the reverse of the first. It is overcalling ADD, seeing it everywhere. A careful evaluation must take into account a number of conditions that can look just like ADD. Some of these, like hyperthyroidism, require testing by a physician in order to be ruled out. ADD is a comparative diagnosis. It depends not just upon the presence of symptoms, but upon the intensity and duration of those symptoms. Most children are distractible, impulsive, and restless some of the time. The vast majority of children do not have ADD, and one must be very careful not to make the diagnosis so easily that it loses meaning or becomes a fad. For those children who do, in fact, have ADD, it is of great importance that the diagnosis be made as early as possible so as to minimize the damage to self-esteem that usually occurs when these children are misunderstood and labeled lazy or defiant or odd or bad.